Hello, you're welcome to my channel. My name is Adora, and if you're seeing this face for the first time, thank you very much for stopping by. I hope that before you get to the end of the video, you will have a reason to subscribe. And if you're an old-time subscriber, I thank you very much for hanging in there, for watching my videos. I thank you very much for encouraging me, and I hope you continue to do so. Okay, I am Adora. Like I said, I am a healthcare assistant in the UK. I live in the UK with my family, and I have been working as a healthcare assistant since 2019. So, for some time now, I have not uploaded any new video because I have just been passing through some I should say I have just moved from one phase of my life to the other. So I needed time to kind of sink into the new reality and get accustomed to it before I can say, yes, okay, time to do other things, like when you're just moving from one thing to another, and it's especially if it's something that is still new to you, you just need time to understand your new environment, your new situation, and things like that. So that is what has just happened. Okay, I would say I used to be a healthcare assistant, and I'm using the word used to because I just decided to drop, or rather to step aside or step away from that particular field, at least for now. If I'm going to return in future, I don't know. But for now, I just decided to leave that field, to leave that career because of different reasons I'm going to be giving you here on this video. Okay, my story dates back to when I just started working as a healthcare assistant, and that was in 2019. And I have worked in so many fields in the healthcare sector. I've always wanted to help people. I have this passion to help people. People who need help, who need support in different ways. I have worked with the elderly. I have worked with those living with challenging behaviors. That all those that has to do with autism and all that. I've worked with people living with dementia and all that. I've really tested the waters, and I didn't see a time like this coming so soon. It's not like I wanted to be a healthcare worker all my life. No, I knew that at some point I was definitely going to leave it and move on to something else, because I didn't, right when I was in school, secondary school, uni, I didn't read or didn't study anything that had to do with the healthcare sector. I am not science inclined at all. I was in the arts department all through. In the university, I studied a different course that has nothing to do with medicals, healthcare, and all that. So when I found myself in this field, I was like, oh yeah, okay then, let's see how it goes. It's not going to be a forever thing, but I didn't see it ending so soon, like now. So one of the reasons why I went into the healthcare sector is because, like I said, I have this passion for helping people. I am quite an emotional person. Little things trouble me, and when I see people in distress, I always like to lend my support in my own little way. So I went into the field, and I have worked with quite a number of people. But then, at some point, the whole thing started telling on me. Like, I just felt like, initially I was asking myself, are you sure you're doing the right thing? Are you sure you're in the right place? Are you really sure you can do this? But because I didn't want to believe that I was going to give up, I didn't want it to look like, oh no, you have just started something, you haven't even gone so far and you're already giving up. I didn't want to beat myself so much. So I was like, no. I bind this spirit that's trying to discourage me and all that. I'm going to move on, and I'm going to see how long it stays, or how long I stay in it, how long it lasts. So I continued. But one of the reasons, and I should say the major reason why I decided to leave the healthcare sector, is because I discovered that I was suffering from severe anxiety. Like, each time I want to go to work, or each time I have a shift to cover at work, let's say like the shift is in 2 days, 3 days time. The first 2 days I feel okay, I feel normal, and everything is fine. But a day before my shift, I start feeling nervous. I start feeling so confused. Sometimes I start feeling like I should cancel the shift. I can't remember how many times I've cancelled my shift just due to the fact that anxiety took over me. I can't remember how many times I had to cancel at the 11th minute, maybe like 2 hours before my shift. I just call in and say, I'm sorry, I won't be able to come to work today. And, just because I was experiencing something I couldn't really control, and I didn't even have an answer to. I was wondering what exactly is making me so anxious and nervous. Why is it that whenever I want to go to work, whenever it's time to go to work, I start feeling funny? I start feeling strange. I start feeling scared. But once I go to work and I come back, I'm okay, I'm fine. Or any day I don't have a shift, any day I don't have to go to work, I'm brilliant, I'm good. I'm very happy with myself. I don't have a problem. But the moment I say I'm going to work, be it a night shift or a day shift, something just erupts in me that brings up this fear, and I couldn't really lay my hands on it. So I decided to keep a close eye on myself and monitor exactly what was happening to me. So I discovered that most of the time when I work in a particular sector, like when I work with people people living with challenging behaviors, these are people that maybe they find it difficult to do things on their own. You have to support them. They are the ones that you work with, and the supported accommodations and all that. Some of these people really have really challenging behaviors, and it takes a very, very strong-hearted person to work with them. It takes someone that is really, you must be strong-hearted. You must be mentally strong. When I mean mentally strong, you must be mentally strong to deal with some of the things we see at work. This job, being a healthcare assistant, is not for the lily-livered. And I must say, kudos to those who have been doing it for years. When I mean years, they have been at it for years, and whether they are managing it or they are enjoying it, but for the fact they are still there, a big kudos to them. And if you say, oh, I can't work as a healthcare assistant because of my fears of this or that, I don't blame you either, because now that I have been there, I think I'm in a very, very good position to explain or to say the pros and cons of working as a healthcare assistant. So some time ago, I worked as a support worker in a particular home, and this place had to do with people living with challenging behaviors. As far as I'm concerned, from my experience, this is the most difficult part of working in the healthcare sector. The most difficult part, because in as much as they keep telling us don't use the word aggressive, that they are aggressive, or that they try to give them a milder term to cover up the word aggression. But the fact remains that a lot of them, rather some of them, display that aggressive attitude. So when you're working with them, you have to be very careful. There are several times where we've been hit, we've been spat at, we've been, sometimes you even go to work, you've been slapped, pushed around and all that by, the people you are looking after. And the funny part of it is that when these things happen, it's like insurance covers them. It doesn't cover you, the staff. You cannot in any circumstances whatsoever, you have no right to retaliate, because as it is, they are vulnerable. It's believed that they don't even know what they are doing to you. They have no control of what they are doing. They can hit at you, spit at you, push you around, do whatever. They do not know what they're doing. So you, the staff, you have more control over yourself than they do. You are the one that is now in position to say, okay, fine, I'll let that pass because he's not in control of himself. He doesn't know what he's doing. Then you keep yourself to yourself. You comport yourself. And now that's where the spirit of patience and tolerance really needs to possess you. Because I know, or I've heard a lot of stories where people attempted to do back, like to hit back. Maybe some of these vulnerable people hit them or beat them, and out of annoyance, they're like, why would you do that to me? And you kind of hit back. And when you do that, you have just broken the code of conduct. You have just put yourself in trouble because you were not allowed to. So that's why I said it takes a lot of mental strength to endure some of these things that goes on, that you see, that is part of the job. It takes a lot of mental strength. Sometimes you're going to be abused physically. Sometimes you're going to be abused racially. So if you know you are the type that, okay, anytime you hear anything that has to do with your skin color, maybe you're very sensitive to people talking about your skin color. If you're not like if you're a black person and someone says something about a black says, uses a racist word or a racist slur against you or whatever, if you're that kind of person that gets very sensitive in such things, I don't think this is a field for you, because you're definitely going to see it. I'm not saying that in other careers or other fields or whatever that there are no racist people there, but like in this particular one, you're definitely going to see it from time to time. It's like it's almost the norm. So several times when you're working with such people, such vulnerable group of people, you're definitely going to see all this hitting. It's like and you just have to comport yourself. You have to be tolerant. You just have to understand the fact that whoever is doing this to you is not doing it with his or her clear eyes. Just because they are not feeling too well, that's why they are able to do this kind of things to you. And you do not have any right, like I said, to retaliate. So this is where you have to really be conscious of your actions. You have to be conscious of your speech. How you don't have to like talk back. Yes, you have to you can caution them. Don't do this and don't do that. But you're not gonna use swear words on them, even if they use swear words on you. So it takes a lot of patience. It takes a lot of what's this word? You have to really discipline. It takes a lot of discipline to work in this field. You have to really discipline yourself. You have to keep your hands to yourself, and you have to, in most cases, zip your mouth, because we are humans. There are some things people will do to you. You want to retaliate. You just want to do back, out of anger. At that moment when the anger rush is still there, you want to do something. But in this job, you have to be very careful. Now, this brings me back to one experience I had some months back. I was working in this particular place, and man, it was not funny at all. That period there? Okay, let me give you another example. This was the one that actually weighed me down and made me want to even quit long before now. During the COVID, I'm talking about the very first COVID lockdown we had in the UK. When the COVID just started, everywhere was shaking, COVID. So I went to work, and because I was doing the night shifts. I used to work as a night shift staff there. So I went to work that particular night, and on getting there, I and two of my colleagues that night, and we were actually working. In fact, it was supposed to be just me and someone else, one other colleague, working with this gentleman who is vulnerable, and he has a lot of issues going on with him. He actually has dementia. He's autistic. There's a lot going on with him. There's a lot. He can be happy this moment, the next minute he's angry. He can be smiling with you this moment, the next minute he's hitting at you, he's kicking you and all that. So I went to work that day. It was in the peak of the COVID. We were all wearing masks and gloves and aprons and all that. And few hours into our shift, everything was fine, And at about 2 o'clock in the morning, like 2 a.m., like 2 midnight or 2 a.m., this man started. I don't know, there was no reason. He came out from his room. He said he was hungry. We made some things for him to eat. After eating, he started kicking out, shouting. And it was very, very late at night. Everyone has already gone home. All the staff had gone home. Just a few of us there. The whole building was echoing. He was shouting. We tried to, know exactly what the problem is. When you come close to him, he spits at you. And this is someone spitting at you in the peak of this whole COVID thing. You're trying to be careful. You're trying to protect yourself. And this someone, it was a bit confusing. So we had to stand back, to protect ourselves from the spit and all that. And he will come close to you. He'll try to lash out. He'll try to kick you. He'll try to hit you. He'll try to... And in this job, no matter how aggressive they could be, you have no right to restrict them. You have no right to lock them in the room. You have no right to chain them on the chair. You have no right to put them in a particular place just, to calm them down, or you have no right to do anything that will forcefully keep them stuck in a place. You can only convince them, talk to them, please, can you sit down here? Please, can you do this? You just try to prompt them, but you do not have any right to put them down. So when this man was doing all these things, he was doing kicking, throwing tables, throwing chair. At a point, he used his hand, he hit his television, everything was buzz in the whole house. All we could do was just run around. We're running around because if this man hits you, and he's very, very strong, and these are ladies, me and my colleague was a lady. So this is a man that was just chasing us up and down. And if it is just the chasing around at night, it is even okay. But when he decides to calm down, and you also calm down thinking all is well, and okay, fine, he has settled down. The next minute, he will just lash out at you. If you're not careful, he will grab your hand. It was scary. It was really, really scary. And to also discover that this is a man that shouldn't even be in that kind of setting. This man should be in the hospital. He should be in the psychiatric hospital where that kind of assistance that he needs, because where he was staying is not the kind of help or support we're giving to them. It's not the kind of support that they deserve. They needed a more kind of extensive support, the one that can restrict them a little bit more, the ones that you are actually trained to restrict them. We were not that trained to restrict his kind of outburst. So we're just taking it very calm because we didn't know what to do. At a point we were confused. Then this carried on the whole night, the banging, the hitting, and by the next morning, I and my colleague were worn out, we were tired, we were stressed out. So I experienced this, but I didn't want to give up because I'm a kind of person that I always want to see the end of a story, the end of the matter before I say I'm not doing it again. So I continued, and one other day again, I came to work, and this time around, I came to work that night. I wasn't even told that a new resident just joined. Now, we call them residents. Residents are these vulnerable people that we look after. He just joined that afternoon, and I resumed work at night. So I didn't even know what it is like to look after this guy, or what exactly he likes or he doesn't like. So immediately I resumed. They just gave me his care plan. The care plan is like a diary that states everything you need to know about the person you're looking after. So I went through the care plan fast because he was sleeping, and decided to read to know about this new person that just joined us. So from the care plan, immediately I read it, I was scared. Because I was like, wow, this person that just moved in is even worse than the other person that we were struggling with. They said this one, he goes straight for your neck. Once he sees you, he's going straight for your neck. If you're putting on necklace, if you wear necklace, or you have anything that has to do with like a cord, a rope around your neck, that's what he comes for. So immediately I read that part. I was wearing a necklace that night. I was like, I quickly removed my necklace and put it in my pocket. And I was the only one with this guy that night. So at about past 12 midnight, he woke up. He came straight to I was in the sitting room. He came straight to the sitting room. He looked around, looked at me, and he was coming straight to me. And I was like, oh my God, and I'm here alone with this guy. So immediately he came close to me and he tried to grab my neck. I quickly pressed the buzzer, the alarm, and my colleagues from other places, they came in to assist me. So this and so many other experiences, I just said to myself, listen, if any of these people kill me here, I'm on my own. Because funny enough, in this industry, you're on your own, believe it or not. If there's any insurance that covers life and property of anyone associated with this kind of job, it is referring to those people you are looking after, and not you, the carers. Not you, the carer. So if in the point of your duty, or if in the course of your duty something happens, and maybe the people you're looking after or someone you're looking after actually lashes out at you and start hitting you and beating you, like I said, you don't have any right to beat back. The moment you raise your hand to beat back, that is when when the law catches up with you. It will not catch up with the person who just raised his hand on you, because it is perceived that he is not in control of what he is doing. because of this mental health. So you that don't have any mental health issues, you are going straight to jail. So you have to be very careful. So when that particular one happened, that night I was like, no, I'm done working here. So I quit that particular company because I had it that I believe that it was just that place I was working. If I go somewhere else, it might be better. I might have a better experience. So I worked with a couple of agencies. They keep saying they send you from place to place, go and cover this shift here, go and cover this shift here. And that gave me the opportunity to go around, to test a lot of companies, to test a lot of support living homes, to test a lot of care homes, to test a lot of places. And I discovered that, well, listen, it's the same thing anywhere you go. It's the same kind of people with the same kind of mental health problems that you see anywhere you go. It's the same kind of response that you are expected to give to them anywhere you go, because you are trained to be calm irrespective of what is happening. You are trained to be quiet. You are trained to tolerate. So if you're not a tolerant type of person, this job is definitely not for you. So I tested a lot of companies and I discovered they're all the same. Another day, there was another company that sent me to cover a shift somewhere. So I went to work that night. It's a beautiful house and there are about 11 residents there. So at night, a particular one, he just woke up at night. And it was later I discovered that they said he sleeps all day and wakes up at night. So he woke up that night, he went to the kitchen and he was actually using his hand. He put his hand in the counter, where they put food stuffs and everything, canteen, all the canned food. He would put his hand like this and he would clear everything, everything will fall. And at night, the whole place was echoing. He was actually, I was like, God, which one be this one again? Then he would go from door to door, knocking on all the doors, waking everybody up sleeping. And when they all come out, and I'm the only staff, I was the only person that night. So when they all come out, they find it difficult to go back to sleep. They were all walking around. I was trying to control it. I'll take this one, please, let's go back to bed. I'll take that one, I'll put in the room. I'll go back, take another person, put in the room. Go back, take another person, put out. This was how I was going up and down. But this particular man that caused this commotion that night was not hearing any of it. He was moving around, throwing things, pouring water on the floor, smashing the glass. At a point, there was a big mirror on the wall there. He pulled the mirror down, smashed it. That was when I became scared, because I said, now he has smashed this glass. He might decide to just take a piece of it and cut himself or cut someone. I was really worried. So immediately he smashed the glass. I tried to to console him and calm him and take him to his room. So I will sweep off. Now I clean off the glass first. I know that I'm done with that one. So I tidied up the floor and the glass and pushed everything away. And that was not the end. He continued to the next morning. And this was another experience I had that made me asking myself, are you sure you're up for this? But I continued. And then I decided to test the care homes. So I said, okay. I was loving it at some point because I was like, okay, these are elderly people and they are a bit calmer. They are not the like the ones that have mental health problem and all that. And it was okay. It was nice. And I've been there for quite a while. And I must say, I actually have more peace of mind working with them than the other group of people that I worked with. But another reason why I decided to quit was I just feel this job, if you need to go into it, you need to be strong. There were so many things I was seeing in the course of this job that was really shaking me. It was putting me off. It was torturing me, even though I was trying to be strong, even though I was trying to say, no, I'm going to do this, but it was doing something to me. Like, I'm not the kind of person that likes to see poo right from when I was small. Even when I go to toilets, I don't like to look into the toilet to see what I have just excreted. I don't like it. But now coming to work in that sector where you'll be seeing the thing, it was irritating me. I felt like I don't know how to explain it, but I couldn't cope. I couldn't just be coping with things like this. It was looking dirty. It was dirty to me. So if you're not the kind of person that likes to see mess like that, poo, pee, vomit and all that, good. The job is yours. But if you're the kind of person that gets irritated by such, it will get to a point where you will feel like, no, I've had enough. And that was what happened to me. I just said, no, I've had enough of this. I think I need something a job that's a little bit more devoid of this kind of things. I'm really getting tired. I'm getting tired of all this. And then another issue was the racism that had to do with this. Now, I live in UK. Racism is not something that you take lightly, especially if you're the kind of person that knows yourself. In different fields, there are racist people who, in different fields, be you working in the construction department, even if you're working in the shops, supermarkets, you're definitely going to see a few racist people that, but that was not the problem. Being racist to me in the job I do is not the issue at all. I didn't just come to the UK yesterday, so your racism does not in any way, make me feel bad or feel less of myself. But the problem is, when I'm doing your dirty job and you're still being racist to me on top of the fact that I'm cleaning your mess. Like, at a point I said, no way, I'm tired. I can't be cleaning your mess. And you're still using maybe some slur words at me. You're still using some abusive racist words at me. And I'm doing that dirty thing for you. I think being a healthcare assistant is a very difficult job, and they deserve, healthcare assistants, whether we believe it or not, they deserve very good pay. They deserve fantastic pay. And they deserve a lot of respect because they put in more effort into their jobs than you can imagine. It would surprise you to know that a lot of people who work in the shops are even more paid than healthcare assistants, except you work with agencies. But if you decide to work like permanent, if you be a permanent healthcare assistant, they are not really valued. Okay, look at what happened during all this COVID thing, when they were clap for NHS carers, clap for this, clap for that. The healthcare assistants were like invisible. Even when they are acknowledging people who work in the healthcare in the medical field, or who work as people who look after people, or when they are acknowledging people who are essential workers and all that, the healthcare sector is actually giving very, very little recognition. But they do a lot. You need to see what a healthcare assistant does from day to day in the course of their duty. If you are not a strong person, you will not be able to cope. With the long hours they take at work, sometimes you go to work 7 o'clock, you're not back till 10 in the evening. Healthcare assistants are the only people I know that work very long shifts. Like, I've never seen somebody in my life before doing 14-hour shifts a day. Not 14 hours in 2 days, 14-hour shift a day, 12-hour shift. I have never seen it. But in the healthcare sector, you find a lot of these things. So it got to me, I was like, no, it's too much. I can't be doing these long hours. It's crazy. Like, how can you do 14 hours? Like, I don't get it. There's something off about it. So that was why I decided to quit the day shift and do night, because night was actually 10 hours, 8 to 8 in the morning. 12 hours, sometimes 10 hours, but I was doing 10 hours because my company had only 10 hours. So that was 10 to 8 in the morning. So I was doing it because it was a bit shorter. And secondly, because I thought as night staff, you will have more time to do what you want to do in the morning, in the daytime, and then just go to work at night. But on the other hand, my children were suffering it, because many times I want to go to work, my children will be like, "Mommy, don't go to work this night. Don't go to work this night." They didn't really like the fact that I was not spending time with them at night. Sometimes because of the cold, my kids, when they are sleeping, they use their leg, they kick their duvet, their blankets away and all that. And you have to be very, very protective of these children. This is a region that is always very cold. You have to take care of their chest, their ribs, make sure they are very warm to avoid cold entering into their body. So I like to monitor them at night. Every night I can wake up as much as 2-3 times just to check the children, just to check if they are well covered and all that. But when I was doing the night shift, I wasn't doing it, and I was always, even when I go to work, I'm always like, God, who knows how this boy is sleeping? Who knows how this girl is sleeping? I hope they have not kicked off their blanket. I hope they are not cold and all the things like that. So I just felt like, I need time for my children. I need time for myself. And then secondly, I need to work on my mental health, because the job was affecting me here. I was beginning to be paranoid. I was really beginning to ask myself a lot of questions like, are you sure this is what you want to do? So I just made up my mind that, you know what? let me give it a break for now. Let me just assume I am on a break. If I'm going to return back to this field in future, I have no idea. But in case I do, I would prepare myself better towards, towards absorbing all that comes with it, if I'm going to continue. But if I'm not going to continue, I will just move into something else that gives me more peace of mind, that gives me more time to myself and my kids, that resonates more with what I believe in, what I think in, and what I'm happier to do. So that's the update I have been holding on to myself. I really needed to be sure I'm on the right path before I do this video. So that's one of the reasons, rather, that's the reason why I have just quit working as a healthcare assistant. Thank you very much for watching my video. If you have not subscribed to my video, please press the subscribe button so that when I bring any updates, in case I decide to go back working as a healthcare assistant, you will be the first to know. Thank you very much and have a lovely day. Bye.